Welcome all to yet another episode of HomeoMitra Vartaalap. Uh, Today, we are at Dr. Dhawale Memorial Homoeopathic Institute, Palghar, with Dr. Sunita Nikumbh, who is the head of Department of Psychiatry. And we are going to talk about a topic which is discussed, but probably the research part of that, I think, may not be, people may not be as familiar with the research part. So, we'll be talking about autism research today. Dr. Sunita Nikumbh has been my teacher. I have learned under her guidance. If you allow me to introduce you, she has been associated with the college since quite a long time now. And she has been teaching psychiatry and homeopathy at Dr. Dhawale Memorial Homoeopathic Institute, as well as she has been part of many projects which involve treating children with homeopathy, especially those who have got scholastic difficulties, ADHD, autism. So, madam, I would request you to tell us something about yourself.
Namaste. Uh, as you have introduced me, before joining the MLD MHI, I was a student of ICR, the Institute of Clinical Research. And my basic training after my graduation occurred from 1998, and you can say till today. I have been learning, and it has been a very great experience of learning first homeopathy and then its application in the psychiatry, general as well as the child psychiatry, even the community psychiatry, which you have already mentioned. I have been a part of lot many community outreach projects. So this is the journey of last, you can say, 25 years, where
Wow.
homeopathy and psychiatry still we are learning.
Wow, 25 years is quite a long time, and I'm sure we are going to learn a lot in this podcast in the next hour or so with her. So stay tuned, do not stop in between, do not fast forward, and watch till the end. So, Sunita madam, before we begin, if we can touch the basics, what is autism? I'm sure people know, but from your perspective, from your experience, if you could just share something about autism.
Yes. We all know autism is a neurodevelopmental disorder. Means what? Where the brain has developed, but some of its functions and the interconnections of those functions are not developed. If you ask me what is a common name or how common man can understand this autism, so there is a very you can say apt word in the Sanskrit or in the Marathi, which is named as swamagnata, where the child is engrossed in himself and he is least bother about what is happening around, whether he is able to communicate, not communicate, whether he is getting affected by anything occurring outside his world. So he is on his own world, and hence the term swamagnata, and which aptly describe the neurodevelopmental disorder and autism, where the physical growth is occurred, but not the functional part of brain is not developed that much. So they can, you can say ki the certain functions are impaired where the coordination is required between the two or multiple parts of brain.
Madam, are there any causes that we have been able to ascertain?
This disease is multifactorial. Still, we are able to pinpoint what exactly the cause for that, and hence it is called as a multifactorial. Some part of a genetic is responsible, where in the family there had been a child who is not normal, maybe intellectually, maybe some physically, even some part of a nourishment or a nutrition also comes into this, where mother as well as the child has not received the adequate nutrition during the gestational period of mother's pregnancy. It could be even the vaccination. Nowadays this concept has come up that certain vaccinations are equally responsible for that. And most important is mother's mental state during the pregnancy. If the mother is not happy during, maybe at the time of conception and the entire period of pregnancy, so it is considered ki that also is responsible for the development of this problem in child.
Now, this mother's history during pregnancy, I believe this is very specific to homeopathy because I do not recall this in any of the modern medicine content where they have mentioned that something from
Yes,
the
yes.
mother's history is. So if you could just elaborate a bit about.
uh, from the homeopathic perspective, Why this is important? uh, at the time of conception, if the mother is not happy, if the child is not wanted, or if the child is not planned as per the mutual decision or a discussion with the partner, then that is going to take a toll of a mother. If the child is not born out of a proper wedlock, so everything is going to hamper the mother's mental state, which could be anxiety, which could be the aggression, anger, could be separation also. And in a way, this state is going to hamper the development of a child at a cellular level and then at a organ level as well. So this is, though this is a homeopathic concept, but this is most important and crucial to assess and evaluate from the the management part of child as well.
Yeah, correct. I understand. So, meaning if the mother is not in that kind of a state and there is an unresolved conflict or
Correct.
some trauma which has happened at that time, and if it is not resolved, then handling the child would probably be
Yes.
difficult.
Yes. Yes.
That makes sense. So, tell me if you have heard something like this before from any of your doctors or from any of the research papers, and do mention that in the comment. Any particular symptoms of autism that which are very obvious, which someone can look and identify, and how does one understand what are the symptoms of autism?
Autism is called as a autism spectrum disorder. When you are talking of a spectrum, it may have a symptom or a behavior related to so many other parts of body functioning or a personality development. So when any child is in a developing stage, so right from the age where he started or he starts interacting with the people around, the child will not have a eye to eye contact, which is very very important. So you are able to see the child is not able to form a certain communicative pattern, which probably can go into the category or a diagnosis of autism, where certain words the child is speaking, the words can be repetitive, or if any question is also asked, the child may reproduce that question or those words again and again. So in the behavior wise also, he will be repeating certain activities. The activities probably will not make any sense to us, but those activities are very obvious. As the age advances, the certain activity the child stop doing that. But in cases of children who are having this autism, their activities can be repetitive. They will not understand any purpose behind that, because eventually child learns how to uh, do some gesture which has a purpose. For example, if the child is hungry and he wants to get something from the mother, so either he will point to the mother or he will ask for something, but this child will go on doing the same activity that we called as a repetitive activity, a purposeless activity. At the same time, child will not be very comfortable in the people who are around. He may be attached with his mother or whoever is a primary caretaker. So even the either of the parent, he will not be showing any affection in the initial part. uh, when he go to the extended family, he will not be comfortable. He will like to go home if he is outside or if he is in a social function. If he's in the nursery, so he will not like to go to the teacher also. Some part of this can be counted as a behavioral expression. At the same time, child will be very sensitive to the noises. With the slightest voice, you might have observed that some people are all the time keeping their hands on the ear so that they want to avoid those voice noises. So that can be one of the feature. Child may show some kind of a obsession towards some color, specific toys. Who will go on collecting without any purpose. At the same time, child can be very hyperactive, very difficult for mother to handle. He will be just roaming here and there. He probably have the expressions like hyperactivity all the time, the so on. And at the same time, even the sleep will be very light or alert. The slightest noise will wake him up.
That is interesting. Now there are so many symptoms. I mean, do you see these symptoms in all children? Like all symptoms are there in all autistic children, or do they differ?
See, diagnosis is not based on the mathematical calculation. If you have some symptoms of, say, behavior, some symptoms of this communication, so it is not like this. In some children, they may come or they may present in a varied intensity. The child who cannot have eye to eye contact may be engrossed in other activity. He will be quite, you can say, he will be sitting without any much of activity, and he will be doing his task. So those also we can see the intensity and the you can say the disturbances in conducting himself in the future life, or communicating with the world, will be disturbed gross. So it will not be a mathematical calculation, it will not be only eye to eye contact, not only repetitive. So we have to see how child is progressively showing these complaints, and what is exactly hampering because of. So the diagnosis is made on this. So
So I think that is why we need someone who is an expert in autism, someone who has been seeing children day in and day out of autistic spectrum, and then therefore it becomes easier to identify, because sometimes it may happen that one odd symptom is there in the beginning, and we may miss it out, and then eventually when it becomes flared up, or more symptoms get added, that is when the problem happens.
correct. So I would like to add, you as you have rightly mentioned. See, when you're talking about a symptom syndrome, so many time even the parental subjectivity or parental anxiety of knowing whether my child is normal or not. So that also may mix up with the actual diagnosis of the autism. So it is better the child should be evaluated on certain standardized scales. So we have a autism rating scale, we have a um, ESA, which is suitable for the Indian standards of assessment of autism. So if we are going for authentic or reliable test, so those also helps in coming to the final diagnosis of autism.
Right now, see, this is what makes it even more interesting. Right, like I said, going to the specialist for treatment of, because there are scales which are involved. Because I think
Yes.
unlike the blood investigations, I'm sure there must be no way to identify if a child has autism using a blood test. So therefore, the scales probably become
Yes.
critical in evaluating
Yes.
autism. Right. So,
Can I add one more?
sure, sure, please.
See, all these scale, the psychometric scales, they are performed by a clinical psychologist. So, definitely the subjectivity will not come into the assessment of the child. And at the same time, all the scales which we are using are standardized. Earlier, the cars which we are using, so that cars has now Indianized, because many of the symptom they differ from the Western point of view and the Indian context point of view. So always it is better to have a formal assessment with an expert.
I understand. And this Indianized part, no, I was referring before we were studying for this
Huh.
podcast, that the incidence of autism is far more in the Western countries compared to India. In India, the incidence is still less. I think it's about 25 to 30 per 100.
36,
Something like that.
36 children
Ha,
per you can say 1,000.
yes,
Hmm.
yes. How has your experience been in treating autism? And particularly, I want to know about the homeopathic aspect. Of course, there are aspects other than medicine also. And why I'm asking about homeopathy is because in modern medicine, they say that there is no so called medicine for autism. But in homeopathy, we give medicine for autism.
Yes.
So, how has it been?
See, if I have to answer this question from the homeopath's perspective, we homeopath handle any child holistically. What do you mean by holistically? We take the information of a child right from its birth, how he is, he, what do you call it, how he has come into this world, whether he had any difficulty like during delivery, parturition, what we called as a in a clinical term, whether he had any problem, whether he cried immediately, if not. See, why these things are important? Because these are important for the physical as well as the development, mental development of a child at every stage of point. So, if the child is speaking at a right time, with a right, you can say, the speech, the words, which will probably give a little more progression to the development at a organ level and at the psychological level. So homeopathically, when we are taking any information or collecting the data from the mother, we should have all this thing in detail. At the same time, as I mentioned in the beginning, ki how a mother's mental state is important, because many time the environment in the family also needs to be considered, because that is going to affect the mother and child relationship, the bond, and even the child's bond with the other family members and the extended family member. At the same time, how the child is taking his food, how he is reacting to certain allergens, how he is showing some changes with the environmental this thing also. So holistically, when you are taking all this information, we are able to reach to a remedy which probably is more simillimum as per the his constitution. And that's why it is important from that point of view, you should pay attention to that. At the same time, the miasmatic concept, which probably still is not prevalent in other medical world, but Hahnemann has spoke about the miasms, and we have studied how the miasm can alter the growth and the development of a child. At the same time, even the diseases, though we are saying certain diseases are genetic, right now we also have come up with the idea of epigenetics, and people are saying if you are modulated the genes at a work certain time, so probably certain disability, certain diseases you are able to take care of. So this concept the Hahnemann has already spoken of in 17th century. So if you are able to understand what miasm was acting at the time of uh, pregnancy, before that, even mother, if the mother has a family strong family history of any miasmatic disease, so that may affect the child's growth in terms of development of mind and body as well. So that is the reason why the holistic view we should take in treating any child who is having autism.
So, madam, just one request, because this podcast is going to be for everyone, even people who are not doctors, homeopath are going to listen to this. If you could just, in simple terms, elaborate what is simillimum and what is miasm.
Simillimum is the remedy. I think before going to the simillimum, I think I should explain how the homeopathy works, or how homeopath think of any remedy. Uh, in homeopathy, we say कि patient is one personality. Uh, like our all the fingers of one hand are not same. In the same way, the all the childrens of one mother will not be same. So there lies the concept of individualization. So every person is a unique, though he has come up or he has born in a one particular environment, but still, as per the law of first law of psychology, nature and nurture, every child will grow in a different pattern. Maybe certain things are impacting his growth at that time also. Even birth order, one of the psychologists has talked about, John Bowlby, who has spoke about ki even the first child of the family will be different, the second child or a middle child is different, and the youngest child will be different. So many psychological theories also you can study from that individualization point of view, ki how the child is even received in the family, how the nurture has occurred. So when you are talking up any child, every child has born with all this factor which probably is unconsciously acting on him. So suppose if the child of autism is coming with a certain set of symptom, and we are studying this particular case, we have recorded in a format, then we need to see which are the remedies may have this characteristic expression. Suppose if the child is hyperactivity, and in that hyperactivity he is constantly jumping, he is not resting, and we call that as a jumping jack. So you have to select the remedy which probably have this as a one of the prominent symptom. So if you are able to identify, again it is not a calculation ki the child has 5 characteristic symptom and your remedy selected should also have a 5 characteristic symptom. So we have to see the how the child has become a patient. So we called as a evolution of disease. So how the child has evolved with the disease, and which remedy has a one particular evolution. So along with the characteristic symptom, the pace of illness, or a pace of disease, and the environment. So if you study that, and if the remedy is matching with the patient symptom and whatever the proving the Matra Medica has, so we select medicine based on that, and the that remedy is called as a similimum medicine.
So I think two things now I understand. One is that such variations happen to change the remedy, and therefore this long case taking that happens.
Yes.
And the second thing is that Mayasm aspect is, and of course the psychology part is, this is where it bridges with the modern concepts of psychology as well as genetics. So yeah, so homeopathy is pretty much up to date in that sense. So two things I gather over here is one is, or rather, let me put it in one. It is the connect between homeopathy uh, and modern medicine, especially from psychological perspective and the genetic perspective. The individualization part, that even
Yes.
one variation in the child and the remedy changes, and therefore the result of what comes up changes.
Correct. So individualization, at the same time, as I mentioned, we consider man as a whole. So that also the principle which our sir, Guru, Dr. M.L. Dhawale has put forth, ki how the hereditary plays a role, how the environment also plays role in the development of this, along with the stresses, and of course the Samuel Hahnemann who has come up with this particular phenomena.
Yeah, I think that was quite informative so far. Now we are going to enter the core subject, which is autism research. So, madam, I have known that you have published papers and you have also been outside of India to demonstrate the results and show it to the outside world. So, if you could just put some light on it, what are the topics? What was your finding when, after so many years of dealing with autism?
The research paper which I have presented at International Developmental Pediatrics Conference, Manila, which took place in December 2019. And there, my paper was selected for the poster presentation. But that time also, you have to present the poster in front of judges. And it was a case research of 20 children, and what we have identified, and see, though the paper was published in 2019, but our OPD was going on before that also. So if I have to recollect what was the scenario at that time, when the autism word was also quite new, and since we have been practicing in this area since 25 years, people were not well versed with the autism as a diagnosis. So people, when they approached us for a very classical complaint. For example, the child is 6 year old, and still he cannot speak correctly. His sentences are very short. He is not wanting to go to the friends. He is not playing with them. He is playing alone, or he has some difficulty in school where the children are bullying him. The children are not accepting him in the classes. So those were the complaint with which the parent used to bring the children to us. And when we started taking up the detailed information, then we started getting this symptom syndrome, and it was really difficult ki how we can put up these expressions into a diagnosis of autism, because 20 years back, even the facility of clinical psychologist was very rare for us. So, and for people from this area, they would hardly ready to go to the nearest city where this testing can be done, because that involve lot of commuting problem also. So our international classification that did help us in coming to the diagnosis. So the way in which the symptoms were presented to us, we decided to conduct a study based on that. If these are the presenting symptom, and if this is a classical diagnosis, or a, you can say, the clinical diagnosis we are giving, so what happens with this symptom when you start treating them homeopathically? And what we come to know, if the children who are of less age or are very young, recently come up with this issue, those children have started showing a good response with the homeopathic medicines. Like for example, if the child is unable to speak clearly, so the child started speaking clearly. See, at the age of 4, if the child is not speaking, that is a major concern for the family members to which is bothering also. So with the medication, that thing has started showing first improvement. Even the aggression, where the child is unable to put forth what he is expecting or what he wanting to convey, and where the child was unable to do that, so that behavior, the aggression part, even the some you can say the expressions of aggression, where the child was throwing the objects, beating the other children, so that has reduced. Even the eye to eye contact has started showing a good change. So these changes we started noting. At the same time, we calculated with the cost effectiveness of the treatment. As you know, how minimal we still charges to our patient. And if I have to recollect the 15 years back, our OPD charges, see, we were charging 30 rupees for week's medicine 15 years back. But that also, though, at that time, the parents were finding it very difficult to, yeah, spend for the children. So it was a very cost effective. Within 30 rupees of 1 week's medicine, we have shown this improvement. At the same time, we have noted some expressions are showing improvement within, say, 8 to 10 weeks of starting the treatment. So you see how cost effective, and that was also without any ancillary therapies were given to the children. So homeopathy has really helped to the child at that level. So in terms of getting benefited on the time basis, because within a 4 to 6 or a maximum 8 weeks, the child is showing the improvement. Aggression has reduced, the behavior has improved, communication to some pattern has improved, and eventually, so that I presented all these things at that conference, and people really appreciated. But the one sad part of that conference was many of the people, they were not knowing what the homeopathy is or
Oh,
homeopathy was.
okay.
So everybody was curious to know how the homeopathy is helping child to show this kind of a improvement. So that was all the experience. Unfortunately, the COVID stuck within 3 4 months, and we could not really, uh, you can say, publicize that findings or whatever the outcome of that research. But the things are now. But the experience which I got, or learning what we could derive from that experience, is really helping the department nowadays, because even the newcomer in our new resident is also able to spot the diagnosis in very shortest time. And even the posology strategy what we have designed or developed over a period of time by learning or treating these cases is giving a miraculous result within 6 weeks now. So the duration was earlier 6 to 8 weeks, now that has come to 6 to 5 to 6 weeks or something like that. So again, that is a learning ki how the strategy or a posology you decides in these cases can help child to get the response with the homeopathic medicines.
It's quite interesting. They have measured it down to weeks, the results that they get, and they've also measured to the dosages and the cost effectiveness of the medicine. So when it comes to autism and research in Maharashtra, around Mumbai, in Palghar area, this is the place where you need to visit if you are interested. So of course, I leave the email ID and everything in the description, and you can connect over that. How can a homeopath learn about autism?
Hmm.
Because see, autism is something which, as far as I know right now, when it comes to homeopathic practice, people will not, unless now that they are oriented, there is a certain specialist who can treat autism with homeopathy. But otherwise, if a homeopath gets a case of autism, if you can just give a brief guideline how they can go about it, or rather also if you could add what is the time they should refer and not continue, someone who's not specialized in this.
Correct. See, every child is it's a classical, you can say, the concept of developing normal milestones. So we have, you can say, ki every physical development has a certain time duration. Like say by the age of 3, the child should start turning or proning, or a child should speak or should start speaking a complete word or a complete sentences by the year of 1.5, and so, or a child should walk either first with the support and then independent. So if these milestones the child is unable to achieve, so that should be the first indication for a homeopath. If this child is not developing on a normal way, so he should refer whichever the expert he around in his vicinity, he should refer. It can be a pediatrician, it can be a psychologist also. Uh, so that is the first thing the homeopath should know about it. As the milestone everything has achieved, and now the child has been into a family, the people are around there, so any behavior which is showing a little irritation to either to the family members or to the guest or a relative who are visiting also should be paid attention. Because even in the family, we say कि if the child is too much mischievous or restless, we are saying कि अरे ये तो normal है, हर कोई बच्चा करता है, it is not a problematic behavior. But when it start disturbing to the family members, if the and the mother is the first person who is making out this कि my child is really hyperactive too much than as compared to the other children, and if the mother has a first child who is normal, mother themselves start comparing, and she reports to the doctor कि this is been happening with my child, and I'm finding कि he's too restless, too unmanageable uh, uh, for all the activities or all the norms of the family, so called, we call that as so that is the first. If the homeopath is enough to pick up this, what the mother is, because the mother is the most observant, resourceful person who probably can give us the comparative difference between what is normal and what is abnormal. So all these behavioral expression, if we as a homeopath are able to pick up very quickly, and if we refer them, so it would be better. See, even every homeopath, they treat the autism, or they should treat the autism, because homeopathy helps the child very much. So when we are again coming to a characteristic expression, if they are able to identify, okay, this is what the very unique in this child. I'll give you one example. Recently we have a two children uh, to whom we are giving carcinosin. uh, both are of almost a similar age, but one is in from local area, and we are treating another person from Delhi, because the mother's maiden place is here. But after the initial treatment, when the constitutional was decided, and she went back to her workplace, and now she is reporting from Delhi, and child is showing a good improvement. So what is carcinosin? What we are able to see? See, along with the other features of autism spectrum disorder, this both the children, they have a very good quality of putting their every work in an artistic way. If the child, one child who was very fond of soft toys, and he has a range, you can say a variety of soft toys, like from a big soft toys to a very smallest, and he has a peculiar habit of arranging them in a declining way, or you can say हम बोलते हैं ना कि छोटे से लेके बड़े तक या बड़े से लेके छोटे तक. So he would arrange those toys every day. So was the his date start with that. जैसे वो उठता था, he will go to his playroom and he will start arranging that. The another child who has a very particular way of arranging his cars. He has a good collection of cars. But at the same time, one child was very much fond of nature. Uh, you can say he always used to go to the garden, flowers. He will pluck the flowers and he will smell it, and even he will try to draw that flower on the drawing sheet. So this was the quality. If you are able to see along with all this behavioral problem of the child, so even any homeopath treat. But for that, what is required, ki what is common expressions of the disorder and what are the characteristic of that particular disorder. As per the homeopathic concept, we do not treat the disease, we just diagnose the disease. But we see what is characteristic of that individual in that disease. The example which I gave you is the characteristic nature of the child. Though the symptoms of autism was there, but this was the characteristic which the modern medicine called as a obsession. And they called ki the autistic child also has a obsession for one thing. But even in that obsession, we are able to see a characteristic or a individualization. So if the any homeopathy is able to pick up that, then probably we can reach to the masses and we can treat the autistic children in the community.
Correct. I think that makes a lot of sense. Again, this is not to discourage homeopaths from treating autism, but what happens is after a point of time,
Yes.
like simple example, when there is firefighting, you need a firefighter,
Yes.
and I'm sure with autistic children, there are times when actually from what little I know is the child may become very aggressive, stop eating. That is when the expertise.
Yes, yes. See, in the initial period when the child is very young, any homeopath can handle that. Why the homeopathic psychiatrist or what role they will be playing all these things? As the age advances, the problem with these children is also getting multiplied, maybe in terms of behavior, their acceptance in the community or their acceptance in the school, the class, even their ability to convey their discomfort or their any discouragement by the teacher also, because some other experiences do come, though we are now started talking of inclusive education, but still some of the school are not so friendly with the special children. So this kind of a things can come up. So the child, if this kind of a stresses the children of autistic they pass through, they cannot communicate. So there lies the role of homeopathic psychiatrist who will understand what is happening to the child, why it is happening, and how this aggression, how these changes in the behavior can be handled. Even if you see adolescent age where lot of sexuality that comes into picture, where the child is unable to understand why the body is changing, why the certain things are happening to him, in specifically in the female cases where they start menstruating and they find it very difficult to understand why and how, what care needs to be taken and why that is happening to her. So there lies the role of homeopathic psychiatrists who can teach them, or if not, then family can be oriented about ki how this care can be taken, how this children to be made understood, how the care is to be taken. So at certain level, definitely any homeopath can treat, but when the age advances, it is better ki they should come to a expert.
You have a lot of MD students at Dhawale College, and part of their education is their thesis. Has anyone so far taken up any thesis or research in the subject of autism? If you could just tell us briefly about it.
Yeah. At our institute, we are teaching homeopathic psychiatry since 2004-5. That was the first batch I can recollect, and today we are in 2024. In these many years, almost you can say every alternate batch student have taken up some or thing other related to autism. So it can be the expression of autism, it can be a role of homeopathic medicines in autism, the miasm. One of our students, she has taken up a topic of how the parents of autistic children can be handled, they can be oriented, they can be given counseling. So these are the different types, you can say. One you can say the mission of the homeopathic psychiatry in our institute is ki we are working more on a community based need, and we motivate children or a resident to take up those topics so that their learning, their experiences can help the community to have the awareness of specific illnesses, treatment, posology. Because even after this many years of we having on this you can say platform, still the ancillary measures in terms of occupational therapist, speech therapist, or a physiotherapist is still a very, you can say, irregular. Still, people do not want to travel to Palghar because of many reasons. And we are working in whatever the limited resources we have. And still, we are able to give a quality outcome or a quality result. And this is because of a lot of community outreach activity the department has visioned and implemented, and students are also interested because they learn from a hands-on experience with the community, how to go, how to approach the community, how to convince the parents also, or a school authority also, how the orientation is needed even for the teachers. Because even as the cycle of teacher also goes on, whatever the new learning comes up, so they should also be accessible to this new learning, new therapies which are coming up, or what government is also making certain rules. Because in terms of it is not related to autism, but even in the learning disorder, the new lot many concessions over a period of time the government has started giving to the student, and some of the schools are not aware of. So through one dissertation study we are achieving so many things. So our knowledge of student is also increasing, and the community is benefited with our activity.
So just to tell you, dissertation is very much a research paper.
Yes.
The findings are actually usable, citable. So one thing is that where can people find the dissertations done by
Yeah.
the college, where
It's
they
a
can read?
Maharashtra University website, and all the dissertations they are displayed. But I'm not pretty sure of whether the archive can be accessible to all the common people or not. That I think we need to study that. But all the dissertations they are uploaded on the MUHS website archives. Uh, uh, JISH, our journal. So there, one or two papers have been published. So JISH is, I think, anyone can access, and those people, those papers can be accessible from the net side, net also.
Great. And the other thing which I now realize is that occupational therapists, physical therapists, clinical psychologists, counseling psychologists, if you are out there and you want to treat autistic cases, this is the place where people are in short supply in that sense in their expertise. So then you know where to uh,
Approach.
approach. Great. So, madam, with this, I would like to conclude. And with the first thing I would like to conclude is this autism and homeopathy. This is it is in the phase of research. A lot of
Yes.
this has already been done, and of course, a lot will follow in the particular department. So yeah, very much scientific, and people should not refrain from approaching the homeopathic institute, a homeopathic psychiatrist for treating autism with homeopathy. They very well know about right from the assessment to the prognosis, or what we call what happens to the child after a period of time of treatment, and there are results. So, if there is anything you could share with us, what should the people who are listening to this podcast take home? The homeopathic doctors, the family physicians, parents, anyone whom you would like to address.
See, for the non-medical people, what I would ask them, ki they should observe the child. So many time what happens in our society or in our families, we all the time uh, ask a child to do certain the expected activities, but we are not making the child free, and we want to see the child in that particular framework only. Ki whether my child is doing this rightly or not, whether my child is making some mistake, or at the extreme of time, even some families they hardly bother about all these things. So be observant of your children, how they are communicating, how they are making their studies, what mistakes they are doing while doing some task or any other thing. And first is ki, as a take home, I would say ki keep the child away from the social medias, the screen time, which is again one of the, you can say, major hurdle in understanding whether a child is speaking correctly, not because screen time. that is a passive entertainment to the child. Child will listen, child will giggle, child will smile, but if the child is not able to speak because of constantly watching those cartoons which they hardly speak, if the child is not able to understand what is going on, then his speech also will not develop. So be vigilant, be observant, and report all the, you can say, deviated, or no, I will not say the abnormal, but which is not normal as per the standard. Do report to your concerned person, a doctor, maybe homeopath, or maybe any other field expert, and do consult and be regular in treatment. See what I would like to share this very good experience, and that probably has motivated me also in taking up this subject ahead. During the COVID time, maybe before that, uh, one girl, the parent brought that child. When she was brought, she was 7 year old, and till the 7 year, the child was not speaking complete sentences. She had been to other pediatrician and other therapies were given to her, but still the child was not speaking. And we gave her the treatment, and I really appreciate the parental motivation also, and they continued the treatment even during the COVID. And the interesting aspect of that, ki after the COVID, when the this thing was released, and the first community festival had come up of Ganpati, and during that festival, the child recited Atharva Shirsha, the complete Atharva Shirsha in front of the village people, that also from the dais. And that was really very encouraging for us, ki how the children, even at the late age, of course, there is a, you can say, ki, what response will come at what age, that also needs to be studied. Uh, but the child really spoke very good, and unfortunately the parent did not allow us to take the video of that particular child. But the child was observant, they were persistent, and this was the response which has come up in a very shortest time. So irrespective of the other therapies which were given to the child, and if the adjuvant, as a adjuvant therapy, the homeopathy is given or any therapy is given, so the response comes very quickly. So one should be uh, keeping or persistent in taking the treatment as well. And whatever the expert asks them to follow, please follow that.
So I think this was a great conversation. Looking forward to conversation on different topics of
Yes.
child psychiatry in the future. Thank you so
Yes.
much, Sunita madam, for your time.
Yeah.
And yeah, we'll conclude the podcast with this. Thank you.
Thank you. Thank you, Dr. Keur.
Thank you.
Yeah.